Hey, this is Blue Record Studio Episode 1.
I am Yeon Jung.
I am Eun Kim.
And I'm Yoon Young Choi. In this episode, we're now discussing the current global epidemic, the coronavirus 19.
Today we're going to learn about how this destructive disease is going on overall.
Probably something we're noticing in various news channels and articles.
Yes, and we all hope that talking over this topic might give you guys some better insights about the world's current progress on defending against the infection.
Specifically because we're living in South Korea, one of the nations best defending against it. We can maybe share some of South Korea's situation in particular to you guys as well.
Fantastic! So now we're moving on to
the United States,
the third biggest country on our earth.
I assume that there is a probable impact to this country as well. Tell me if I'm wrong.
Yes, you're right.
So, does anybody know how they are handling the coronavirus? Yoon?
Here's what I found out about the situation in the US. An article from Market Watch quotes, "The reality is that many Americans forego healthcare because they are worried they can't afford it. This means that the people in the US are financially oppressed from getting the test to check the symptoms of the virus." So a man in Miami had to take the test since he was just coming back from a work trip in China, and the hospital charged him an overall value of $3,270 as a medical bill.
Wow.
And in the region of Kansas, another debate coach who traveled to Shanghai for a tournament received a $983 bill a few weeks after his test.
That's unfair.
It's so unfair. So this was definitely not a joke for them since the payment of the bill was never told.
Right.
It was a surprise bill for them to deal with.
I would certainly be very reluctant to pay when some paid more and some paid less.
Yeah. So including the specific types of cases, many American citizens are actually experiencing extreme hardship due to the unbelievable high amount of payment.
I relate.
People are reluctant to even reach a doctor for help. In extreme cases, some just decided to bear the virus and stay quiet within their homes. A lot of lawmakers in the US are standing up to claim the right to be treated without the financial burden, especially during the current urgent situation. So, they have called on the government to make testing and treatment free of charge. Yes, this is a very ideal consideration to support the low-income groups who are in desperate need of help.
Definitely.
So, Trump's administration has said the use of federal money could be a possibility to solve this problem. This was Leslie Elbrecht, a personal finance reporter in New York, who shared this info as an article. Thank you, Leslie.
Thank you.
And here's the good news. So for the action to mitigate the financial issue of testing, on March 14th, Saturday, the House of Representatives passed a bipartisan legislative package. The House bill includes free coronavirus tests, even for the uninsured, and paid sick leave for infected American workers. This is good. So this is huge progress within the government, considering one of Trump's earlier news conferences where he criticized the package. Nancy Pelosi, the Speaker of the House of Representatives, was never reluctant to propel the passing of the package with a resolute word. The policy for sure will benefit the citizens. However, the lawmakers still claim for more response.
I certainly believe that the bill would benefit the country hugely. Like, US has only 5 people tested for the virus per 1 million people, and they have the highest death rate for 5.9%. They must act on something.
Certainly. I agree on that, although it is highly doubtful whether they're going to spend the federal cash for that.
In this Paris intensive care unit,
In Spain, the outbreak continues to...
healthcare workers
The destructive pandemic is also impacting the whole of Europe. In fact, one of our major sufferers is Italy. was quite terrifying that hundreds of people were dying in a 24-hour interval, but what's more shocking is that people are neglected for emergency hotlines and funerals because there's so many people dying today. Abandonment. 10 news pages are not enough to commemorate the daily victims. Not enough masks and respirators. And people in Italy are singing in the restaurants in a protest-like unison. Milan, Italy's financial capital, was shut until April 3rd. So approximately 9,000 people migrated to Puglia from the north in 2 days, but many of them are now placed in quarantine. Like imagine hundreds of people crammed in a plane potentially carrying the disease.
Yeah.
In fact, yes, Italians are initially known for handling crises like floods, earthquakes, and the collapsing of bridges. But it intrigued me, why is the coronavirus relatively so unusual?
Right. What is it that makes the virus so unusual?
Maybe it's because there's no vaccine? According to Professor Giorgio Palu, one mistake that Italy has made as precaution is clogging hospitals. Nosocomical transition is a radical problem that exposes healthcare staff and patients to serious infection. I believe that there are about 500 available beds for intensive care in Lombardy's hospital. Yes, which is not enough. So in Italy, I guess it's not about the bills like the US, it's really about the space that's spreading.
Right.
Only a small portion of patients are infected with coronavirus, and they are hospitalized to these negative pressure rooms that are designed to contain airborne contaminants. The problem is, if the small portion infects the larger portion inside the hospital, the situation worsens. It's not like, yes, we have a solution or medicine, so maybe it's best to distance the patients in their houses rather than hospitals. Additionally, it's crucial to let care units be freed quickly to make room for more patients.
Yes, I definitely feel like now is not the time for the government to worry about using their budget. The formation of depth of whatever opportunity costs are what they have to deal with when the situation is mitigated.
Exactly. But would this mean to neglect patients who are in earnest need of treatment? Turin announced that coronavirus victims over 80 will not be allowed to receive intensive care. The same criteria is brought from war, selecting patients by their age and health conditions. Logically, this might be suitable to the overwhelming conditions of hospitals in Italy, suffering the worst outbreak in Europe. But this might not mean to lay aside people in temporary structures outside the hospital all day. Conclusively, Italy is led to this catastrophic calamity.
Well, it seems like Italy is in a desperate situation. And along with the other nations, some of the African countries confirmed their first cases since when the WHO declared the virus as a pandemic. And I was feeling a bit anxious at first when I saw the news that Nigeria had their first case of the virus.
Really? Why were you feeling in such a way?
Well, it was the first case in sub-Saharan Africa, and as you know, the region is often considered to be vulnerable in extreme health calamities like these.
Yes.
The WHO had warned that Africa's fragile health systems makes potential of the virus on the region to be.
Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
Surely, but why does Africa have such a fragile health system?
Well, the continent's vulnerability to such diseases are often referenced with its weak health infrastructure, poverty, conflicts, poor sanitation, and urban crowding. So in the past, Africa has frequently suffered from communicable diseases, which are infectious diseases, and even recently, last year in 2019, the Democratic Republic of Congo declared their 10th outbreak of the Ebola virus. The WHO declared the Ebola outbreak in the Democratic Republic of Congo, DRC, as a public health emergency of international concern in 2018. It is the second largest Ebola outbreak with about 3,400 cases and 2,200 deaths.
Wow.
The 2014-2016 Ebola outbreak in West Africa is the biggest Ebola epidemic ever recorded. There were nearly 11,000 of confirmed deaths, majorly in 3 countries, Guinea, Sierra Leone, and Liberia. Sierra Leone announced their first case of the virus in March 2014, and since then, the numbers drastically increased. The country's health systems were ill-prepared to address the aggravating status, and by March 2016, is recorded to have about a total of 14,000 cases and 4,000 deaths. Yeah, which is more than any other country.
So now that these countries face the dread of the coronavirus, it is a reasonable concern that the high death tolls will be repeated soon enough, right?
Yes, it is. And it is more interesting because most of the people think that way.
What?
Wait, so you're saying and it's not happening that way?
No, it's not. And it is really inspiring that these countries are actively practicing some preventive measures for the virus.
So can you tell us more about it?
Sure, so in Kenya, government installed a quarantine center in their capital Nairobi, even before they had their first case.
Oh.
And in South Africa, citizens could go to private laboratories and pay for private coronavirus tests for about $75. And also when Nigeria had their first case of the virus, the country's health officials were successfully able to trace everyone who came into contact with the patient and make sure that they remained in isolation for their tests.
How could those countries respond in such a manner? Like, are there any foundations for their strong preparedness?
As I said before, these are the countries that have continuously struggled for various diseases in the past. Their experiences in the past to respond to such diseases are viewed to have an advantage in their current epidemic. So, according to the CNN, the past Ebola outbreak is acknowledged for Nigeria's prompt response. During the Ebola incident, the Nigerian government established a massive public health campaign. And also, people who have been exposed to the virus were found and monitored and isolated if they had the symptoms. They have also set up a centralized emergency operations center with experienced staff. And now with the current epidemic, they are able to do the same. When the second case of the coronavirus appeared, the health officials traced the patient and anyone who had contact with the person.
Oh, this is very interesting. You mean that from being at a similar experience, they can eventually safeguard themselves from the disease more efficiently than countries like the US or Italy, for example, right?
Yeah, you're right. The director of Nigerian National Center for Disease Control reported that the system to manage the coronavirus actually worked. They identified a case, diagnosed and isolated within 48 hours of the patient entering the country. He also added that Nigeria has successfully managed Ebola and that they have a strong team that is used to doing this. But there are still weaknesses of the health systems. The number of intensive health care unit beds are extremely limited, and in some cities like Harare, Zimbabwe's capital, has actually none. And in some oil exporting nations in Africa, it is expected that they could lose half of their GDP as oil prices fall. This may impact some countries' health system qualities as their finance diminishes.
So, right, but I think it's still amazing how the developing countries are showing this eager attitude towards saving their people. It is almost like they're resistant to these kinds of epidemic situations since they have already gone through it many times from Ebola and more. Okay, now we need to focus on Korea, South Korea. So, as you guys know, a religious group named Shincheonji in the region of Daegu has found to be the main reason for the drastic increase in the number of infected people of coronavirus in South Korea.
Excluding the issue related to the spread of the virus, many people started to grasp their interest towards investigating what the Shincheonji church really is.
And while there are so many warnings about the danger of getting seized into this group, people designate this type a religious cult.
Okay, so now focusing on the government response of Korea, it has been very controversial within the nation on evaluating the response of the government towards the crisis of intense epidemic. So the government was quick in its action to fuel the progress of creating a well-organized testing program with extensive effort to quarantine infected people and track their location. So the additional laboratory testing to investigate the disease was possible because the government bared the opportunity costs of funding, in other words, encouraging the professional works of field workers. So, and the legislation enabled the government to have the authority to collect a mobile phone, credit card, and further specific data of those identified of having the disease to re-navigate their latest whereabouts. So what do you guys think the info is for?
Through the network, distribute the info to the citizens so they can be aware of where to not go.
That's exactly right. So another positive aspect to point out is the transparency of the report. So the report of the number of diagnostics, infectants, and mortality are the information that people can access so easily just by simply using the internet. No words for people to doubt the words of the government of how they describe the circumstances because they are already aware of the most basic and necessary info to handle an epidemic outbreak as a normal citizen.
Conversely to Yunyoung, I have a different opinion. Like, in terms of the current situation, I consider the past government's response behind time. Like, to briefly inform you, South Korean President Moon is putting massive effort into restoring North Korea relations to reach the breakthrough of Pyongyang. For example, he funded an 11.27 billion won for North Korean project in 2019. So in this process, he is supported by China, North Korea's most important economic and political partner.
Right.
Part of the reason he didn't conclude with a bar entry would be the impact of political association between China and the later Spring Summit visits by Chinese President Xi Jinping. And what I believe got a worry is not donating 1.5 million masks to Chinese. That's good, but not considering the societal aftermath of the virus, that's probably something that can be a little problematic. The best precaution is social distancing. The Korean Medical Association has asserted that temporal travel ban would help much rapidly prevent global widespread. However, on February 13, President Moon predicted this would disappear before long, and Shincheonji, the aforementioned church, interacted with Chinese followers during the February 16 to 21. On February 23rd, President Moon had to raise the coronavirus alert to the highest level.
Well, so eventually, if the president had to put the travel bans, the coronavirus might not have been viral in Korea. So is that right?
Yes. Yeah, that's correct. That week, 1.5 million Koreans signed a petition demanding for Moon's impeachment. So if President Moon did catch the golden time and implemented the travel ban, Daegu might have been shielded, just like the prior government that killed students who rode the ferry, reckoning it wouldn't have much damage. Of course, the main problem came from this church group. But a president who promises that people come first shouldn't necessarily lead the people to death and so much casualties. Yeah, so therefore I believe a travel ban was the appropriate way of elapsing the crisis in South Korea.
Right.
So the criticism about not implementing the travel ban for China is something very critical to think about with great consideration. But some critics claim that the government should be resolute on making these kinds of decisions that involve a lot of international relationships. So China is South Korea's largest trading partner, and therefore it is likely possible to interpret that the government's decision has been generated from the fear of displeasing the Chinese government. And with common sense, I think most people would agree that banning the entrance of citizens from China would definitely offend them. And let's dig deeper with this talk about discussing the management of travel banning, should we?
Sure. I think it would really bring some rich facts about travel banning that people should consider.
So I brought an article from Vox, which was published on January 23rd, 2020. So here's what the title says. The evidence on travel bans for diseases like coronavirus is clear. They don't work. Let's bring one more phrase that's interesting. They are political theater, not good public health policy. So here are the negatives of travel bans. So they damage the economy, hinder the sharing of info between nations, and block all the medical supplies which one country might give to the other in desperate need. A professor in global health at the University of Sydney mentioned that the ineffectiveness of the strategy for preventing the spread of a disease. This is a claim that views travel banning as a block from curing the people already infected, worsening the situation, rather than a solution by blocking the infectants from entering the country.
Right.
So one thing I haven't mentioned is that the ban can be discriminatory towards a targeted specific group of people. So the ban is not just a ban for mitigating the epidemic, it is actually a source of rejection that a whole nation can put on an individual.
Right. Absolutely. Although I agree over the travel ban, it is vital to consider the perspective of people who are highly exposed to the disease. It is at most we do not violate human rights in return of Korea's sole protection.
That's right.
Well, I believe that South Korea is containing the virus very well. I agree that it is a rough start, but then civilians were highly aware of the potential dangers of the virus, which served the response systems well enough.
I agree. The government and the organizations must respond properly to these situations, but the actual preventions highly depend on people's behaviors.
Yes, you're right. The government cannot make sure that the preventive methods are practiced every time.
Yes. Well, of course, there are the exceptions, as you mentioned before, and it has contributed to the spread the most. But then people voluntarily and actively participated in the preventive measures. A lot of people are practicing social distancing, where many organizations cancel group activities immediately after the outbreak, and people are staying in their homes as much as they can.
I also noticed that most of the public areas, stores, and especially restaurants have prepared hand sanitizers as well.
And I want to say that this is not our first time dealing with such diseases. We had the SARS outbreak in
2003.
Yes, 2003. And we recently had the MERS outbreak in 2015.
Yes.
And I think that these experiences in the past have certainly benefited the ability for South Korea to respond quickly to these coronavirus.
Well, absolutely. For the MERS especially, it was the largest outbreak outside the Middle East. These experiences helped not only the government to build a foundation to develop effective governmental and society response, but also it provided the civilians a model of things not to do and things to do. Mostly the MERS virus was spread during a stay in hospital, as people had less awareness of the disease. This time for the coronavirus, people are advised not to go to the hospital when they show the symptoms, and people comply with the rules.
So today for our very first episode, we have prepared some info about the epidemic of coronavirus 19. I really hope that people could be patient and stay positive. As students, we are learning through online, and yes, this can be quite hard sometimes, but once again, let's stay positive and do our best to wait for the day we meet again. So do you guys have some last words?
Well, for me, it was impressive to see how the situations are totally different for the countries. And these case studies give us a lesson of what we should do next if the same pandemic happens again. And well, also, I hope everyone stays safe till the outbreak settles.
Yes, interestingly, I was able to learn about the various global responses to the epidemic, and it somehow really fooled my thoughts about how we should prioritize events relating to the situation. Hopefully, everything would be better since summer, where scientists expect the disease level to drop. But till then, please wear masks and consistently wash your hands.
Report will be back soon
with another interesting
and worthy topic.